Hi, my name is Grace Gonzalez. I'll be doing my physical assessment for N190. I've already checked this patient's vision by having him read off a Snellen chart. He was able to read at line 2020 uncorrected, but was not able to read at the bottom line. I also checked the patient's vital signs in this particular order at 98.1 degrees Fahrenheit. Heart rate was at 62 beats per minute, respiratory rate was at 18 breaths per minute, and blood pressure was at 130 over 72 millimeters of mercury. Hello, my name is Grace Gonzalez. I'll be your nurse for today. Can you tell me your first and last name, please? Can you tell me your birthday? Can you tell me what today's date is? Can you tell me what time of the day it is? And can you tell me who the president is? So what brought you here today? Are you experiencing any pain? No pain? Okay. And can you describe to me your mood? Do you feel content all the time? Or every time you wake up in the morning? You do? Okay. Can you tell me your allergies specifically to medication? Do you have any food allergies? No. Do you have any seasonal allergies such as to dust or pollen? Or environmental allergies? No. Okay, and do you have allergies to latex? No. Okay, and now I'm going to ask you some questions about your bowel and bladder. Can you describe to me the characteristics of your stool, the consistency and the color? Okay, how frequently do you have a bowel movement in a day? Okay, and can you describe to me the color of your urine? How often do you urinate in a day? And when you urinate, do you feel any pain or burning sensation? Or is there a specific odor to your urine? No? Alright, okay, now I'm going to move on to your physical assessment. This is going to allow me to touch you. Is that okay? Alright. Wash my hands. And then I'm going to wipe this with alcohol. I'm going to first inspect your ears. I'm going to check your outer ear for inflammation, swelling, or lesions, which I don't see. I'm checking your ear canal. It is pink with minimal cerumen. Moving over to your other ear. Checking the outer ear for inflammation, swelling, lesions, or drainage, which I don't see. Checking your inner ear. It is pink and minimal cerumen. I'm going to move towards the front, checking if your ears are symmetrical, which they are. I'm looking at your facial features, and they're all symmetrical. I'm going to move on to your mouth. Can you open your mouth for me, please? Okay. Mucosal layer is pink. Teeth are white. I see no redness or inflammation. Can you lift your tongue up to the roof of your mouth? Frenulum is midline. All right. Can you stick your tongue out for me now, please? Okay. Tonsils are at a grade 2. Very good. Can you close your mouth? All right. Now I'm going to check for pupillary reaction. The pupils are equal and round, and they are at 5 millimeters right now. I'm going to come up from this side. Direct reaction present. Consensual constriction present. Direct reaction present. Consensual constriction present. Thank you. And now I'm going to have you follow my finger. I'm going to stand 12 to 18 inches away from you. Just look at the tip of my finger and try not to move your head. Testing the 6 cardinal fields of gaze. And now I'm going to test for accommodation. Eyes were able to accommodate. Thank you. And now can you position yourself at a 45-degree angle? Very good. Can you look over to the left side? No JVD present. I'm going to do the same thing on the other side. Look over to the right. No JVD present. Thank you. Let me place my pen light down and I'll help you. Let me wash my hands and I'll help you reposition really quick. All right, very good. Now I'm going to palpate your lymph nodes, and I'm gonna have to touch you. Is that okay? Okay. I'll wash my hands again. I'm gonna first start off with palpating the preauricular lymph nodes in front of the ear, going toward the back of the ear for postauricular lymph nodes. Now I'm moving towards the bottom of the base of your head, which is occipital lymph nodes, and then I'm moving towards the front under your jaw, retropharyngeal, submaxillary, and at the tip of your jaw, submental. Very good. I'm going to hook my fingers above your clavicle, supraclavicular lymph nodes. Very good. I'm moving over to your side. Going to palpate over your SCM muscle. Now behind it for your cervical chain. Going to do the same thing on the other side. Palpate your SCM muscle and behind it for your cervical chain. Okay, and then I'm going to test your skin turgor. Elastic. Can you shrug your shoulders for me? Okay, I felt no masses while palpating your lymph nodes. Very good. Now I'm going to assess your arms. But upon inspection of your arms, I see no bruises or lesions or scarring. I'm going to palpate your arms. Do you feel any pain or tenderness? No? Checking for temperature, you're warm. And now I am going to check for a capillary refill on the tip of my finger, less than 3 seconds. Doing on the other side, less than 3 seconds. Very good. Can you grasp my fingers and squeeze them as hard as you can? Okay, strength is equal. Very good. Now I'm going to assess your range of motion. Can you put your arms out in front of you? And then take your hands and touch your shoulders. And then extend them back out. Very good. Place your hands to your side. Reach the sky. And set them back down. Very good. And that's to check your range of motion of your shoulders. All right. Now I am going to test your joint reflexes. Just going to wash my hands again. Grab my hammer and wipe it down with alcohol. All right. Now I'm going to check your bicep reflexes. I'm placing my thumb onto your the antecubital area of your arm. I'm going to take the smaller part of my hammer and strike it, and I should see lower arm flexion. Now I'm going to check for symmetry on the other side. Lower arm flexion. Now I'm going to check for your tricep reflexes. I'm going to hold your arm, bend your elbow just slightly, and I'm going to strike right above your elbow to see lower arm extension. Checking for symmetry on the other side. Lower arm extension, very good. Now I'm going to check your brachioradialis reflexes, joint reflexes. I am going to have you just bend your arm slightly and semi-pronate using the bigger part of my hammer, 2 to 3 inches above your wrist, and I should see supination. Checking if supination is present on the other arm, 2 to 3 inches above your wrist. Very good. Reflexes are equal and are graded at 2+. Very good. Oh, before I place this down, can I have you scoot up towards the edge of the chair, have your feet dangle, and I'm just going to check your knee reflexes. Have you had a knee injury or knee surgery recently or in the past? No? Okay, very good. Have you dangle your feet with the bigger part of my hammer. Just gonna strike it, and I should see lower leg extension, and check for symmetry on the other side. Lower leg extension. Okay, and all reflexes were at 2+. Thank you. Okay, now I am going to just wash my hands really quick, and I'm gonna wipe my stethoscope with alcohol. All right, I'm first going to inspect your chest. I see no bruising or lesions or scarring, and I can see that your breathing is symmetrical and unlabored. Now I'm going to listen to your carotid arteries. I'm going to use the bell of my stethoscope. Using the bell of my stethoscope, I'm going to place it between your trachea and your SCM muscle. Can you please hold your breath for me? Okay, no bruise present. Breathe. I'm going to place it between your trachea and your SEM muscle on the other side. Hold your breath. No bruise. Very good. And now I'm going to listen to your heart sounds. I'm going to first start off with the second intercostal space. Right sternal border for your aorta. S2 is louder. Moving on to the left side, second intercostal space, pulmonic. S2 is louder. Erb's point. S1 is equal to S2. Tricuspid. S1 is louder. And now moving on to your mitral midclavicular line and left intercostal space. S1 is louder. Now I'm going to listen to your heart and measure your heart rate for a minute. 64 beats per minute. Okay, very good. Thank you. Now I'm going to listen to your breath sounds. Whenever my stethoscope touches your chest or touches your body, can you take a deep breath for me, please? Okay. Very good. Now moving on to your right side to listen to your right lung. Can you please lift up your arm? I'm going to place my stethoscope at the mid-axillary point of your arm, and it's going to be between the 4th and 6th intercostal space. Okay, very good. Now I'm going to have you turn around for me so that I can listen to the posterior part of your breathing. Very good. Now I'm going to listen to 8 points of your back and making sure that I'm avoiding your bony prominences such as your scapula. Very good. And now I'm going to check your respiratory expansion, placing my hands at T10 and at the bottom of your rib cage. Can you take a deep breath for me? Respiratory expansion present. Thank you. Have you reposition this side again. Now I'm going to assess your abdomen. I'm going to have you lay down. Very good. Wash my hands. I'm going to lift up your shirt. I'm first going to inspect your abdomen. Your umbilicus is midline. Umbilicus is midline, and I see no scarring, lesions, bruises, or striae. Now I'm going to go to your eye level. I see no pulsations, and the abdomen is slightly rounded. Gonna auscultate. Right lower quadrant for 15 seconds. Okay, I heard 16 to 20 gurgles. Now I am going to percuss each region. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and it's all tympani. And now I am going to palpate your abdomen. Let me know if you feel any pain or tenderness. No pain or tenderness stated by the patient. And now with the bell of my stethoscope, I'm going to listen to your arteries. No bruise. Very good. I'm going to place my stethoscope down. I'm going to assess your legs. I'm going to have you come this way for a second. Thank you. Now I'm gonna, your legs, there's no bruises or rashes or lesions that I can see. I'm gonna look below your heel, just a little bit of dirt, no rashes or skin tears that I can see. Very good. Do you feel any pain or tenderness? No? Feel warm? All right. And then cap refill, less than 3 seconds, less than 3 seconds. I'm gonna feel for your popliteal pulses, equal in strength. Okay, now I'm gonna palpate for your dorsalis pedis, locate between your greater toe and your first toe, and it is equal in strength. Okay, very good. Now I'm gonna test your range of motion. Can you take your right leg, bend your knee, and extend it back out? Very good. Take your left leg, flex and extend. Very good. Wiggle your ankles. Okay. And now I'm going to have you stand up. Walk 5 feet. Now walk back, heel to toe in a straight line. Very good. And now I'm going to have you put your feet together. Do a Romberg's test. Check your balance for 30 seconds. 30 seconds. And I saw no swaying from the patient. Very good. Okay. And now I'm going to check your cranial nerves. Can you smile for me? Can you frown? Can you stick your tongue out? Can you stick your tongue out to the side? Can you stick your tongue out to the other side? Very good. Close your eyes. I'm going to do a smell test on you. Okay. Keep your eyes closed. Cover your right nostril. Tell me what smell you smell. Very good. Okay, keep your eyes closed. Cover your other nostril. I'm going to grab a different scent. Let me know what smell it is. Okay, very good. Okay, and while you're seated, can you take your right foot, place it on your left leg, and move it up your shin in a straight line? Very good. Left leg on the right shin, up in a straight line. Very good. And now I'm going to test your hearing. I'm going to come behind you. Stand back from 1 to 2 feet. Can you close your left ear? I'm going to whisper something to you. Repeat it for me. Good. Cover your right ear. Leave your left ear open. I'm going to whisper something. Repeat it to me. Very good. And I'll end my physical assessment. Thank you.